Good morning everybody. OSCE with Bimel എന്ന ചാനലിലേക്ക് സ്വാഗതം. Today we are going to discuss about Australian OSCE scenarioയിലെ blood transfusion reaction station or acute reaction station. So how you are going to work with acute reaction, especially with the blood transfusion. So it's not a simple station. The examiner is looking for how you are going to manage emergencies, how you are going to manage this type of critical conditions, whether you are panicking or you are stable enough to manage this type of situation. Okay, so artificially a scenario will be created in front of you as if it is a panicking situation. Everybody will be running around, and your job is to stay stable and manage the patient. Okay, we will see how it is going to work out in the station. So what is going to happen in the initial steps are pretty same. You have a 2 minutes reading session, and your scenario will be given outside in a tablet. Read out the scenario and familiarize the things. Okay, and the second bell is coming and you have to go inside. You have 8 minutes left over there. Now you have to enter the station, and you have to knock and enter the station. There is a panic situation that is going on there. Patient is shivering and shaking, and people are running around as if it's a blood transfusion is going on there. Okay, chest tightness and stuff like that, and breathing difficulty and stuff like that, the actors will imitate at the stage. So your job is you should not run to the patient. Go with a steady speed to the patient side. Meanwhile, you have to look for two things. One is scene safety. Scene safety, there won't be any problem usually, but you have to look around for scene safety and prompt that scene is safe to approach. Now you have to apply the hand gel. So these two things you have to approach before you have to do before you are approaching the patient. Now you have to quickly approach and you have to introduce yourself. I am the nurse. I am going to take care of you. It looks like if you are not comfortable over there, what's wrong with you? Ask the patient. So patient will tell you, I am not well, I am shaky and shivering and stuff like that. Quickly look at the blood transfusion and stop the transfusion, and prompt that I am going to send the sample to the lab, and prompt that I am going to get the doctor in a minute. Okay, and then prompt I am going to put an IV cannula for your infusion. Don't infuse fluids through this one IV cannula. And also when you are going to take out the bag, and when you are going to take out the IV set, don't throw it away, leave it over there, because this is for the lab to go back. This is going to the lab to go back. Okay, next one is you have to inform the patient to reassure the patient. So talk to the patient, don't worry, I'll be there, I'll keep an eye, don't worry, we have the facility over here to look after you, so don't get upset, I will stay around with you, I will sit here and I will stay with you until the doctors or the medical team is here. Then the next one is this time, once this patient is I explained everything, that is transfusion is stopped, you have to look for the patient's ID. Okay, so there is no need for talking to the patient because patient is very upset. Here you have to ask the patient for permission for taking the ID and read out the ID with the cardex and talk to the patient, is that okay with you? So patient will confirm. Okay, next job is you have to take a vital straight away. Prompt I'm going to take a vital straight away. So the examiner is going to give you a reading in a piece of paper. So the vital signs will be given to you. That will be a bit abnormal reading. So you have to take out, talk to the patient. I'm going to I'm going to fill up the vital signs and I will come back to you. So fill up the vital signs in the news chart, and then you have to prompt the plan. So which one is applicable? For example, nurse referral or MET referral, MDT referral, which one is applicable? You have to prompt for the patient. Then you reassure the patient and stay with the patient, and talk to the patient and interact with the patient, keep on going with the patient. Then now the patient will feel, sometimes the patient will feel, if the patient is feeling dizzy or anything, then allow the patient to go back to, that means you have to make the head low at the stage, and again keep on going with the patient and reassure the patient. You can hold his patient's arm, you can have a shoulder touch, a skin touch, everything is possible at the stage. Now it looks like gradually the actor will settle, and now you have to look for a second vitals. So prompt that I am going to take second vitals, then the examiner is going to give you a second vital straight over there. Then again you have to chart it in the news chart and prompt the plan. So now the things are better, then patient will settle at the stage. So interpret the result and settle the plan. So at the stage after the second vitals, patient will get settled. So you have to reassure the patient, talk to the patient, interact with the patient and stay with the patient. And once the patient is settled, now your job is you have to document everything. Just prompt that. Sometimes there is no documentation there. Prompt that I am going to document everything. Once that is done, and also I'm going to write an incident report. That's very, very important. Then I'm going to stay around here until the doctor is coming. Doctor is on the way. Then give the call bell if you need anything. Press the bell. I will come back to you straight away and say thank you. And if the patient says I'm happy enough, okay, I'm fine, that's okay. We'll wait for the doctor to come in. Yeah, that's it. Thank you very much, and thank you, examiner, and you can come out. So this is the station that's going to happen in case of acute station. In acute station, there is a panicky situation. There will be actors there. There will be volunteers inside. They will be running around and they will make the scene panic. So don't be panic. So your job is you have to be stable enough. So don't run away. With a steady, stable approach, you have to approach the patient. Don't run to the patient because the actors will be looking, oh my God, that's what's happening there. He's going to die. Something like this type of comments will come up over there. Don't go panicking. With a steady speed, you approach the patient. With the proper practice, it's very easy to perform all these steps over there. So if you are going for Australian OSCE at any point of time, then practice is necessary. So try to learn from experts, try to learn from some facility where this type of stations are being explained and this type of stations are being practiced over there. So it's once you have practiced a couple of times, then it is very easy to perform over there. So we are MWT Global Academy. We have extensive training programs for Australian OSCE, UK OSCE, and Ireland Aptitude, and also CBT. If anybody is looking for any program or any training program, please do contact with us. I will give the phone number over here. Okay. Then the other thing is, if you like the video, please like the video and share it for your friends, and also please subscribe my channel. So my plan is to keep on going with videos from UK, Australian and Irish scenarios, and also charts will be explained at some point of time. That will be keep on going. So I hope you have got an idea about this acute station that's going to happen. That's acute blood transfusion station that's going to happen in the Australian scenario. So if you have some questions, please comment us, and if you have some additional information or anything, please do contact with us. So thank you very much for listening with us, and see you next time with another informative video.